NUAA is a peer-based drug user organisation funded primarily by the New South Wales Ministry of Health. We advocate for the health, human rights and dignity of people who use or have used illicit drugs, including those either on or seeking treatment. If we want to provide really excellent health care for people who use drugs, we need to tackle stigma and discrimination. People experience stigma when they feel a sense of rejection based on a personal characteristic, in this case, drug use. Stigma is the attitude and discrimination is the behavior, but discrimination can take many forms. Research shows us that stigma and discrimination lead to poor health outcomes. People avoiding care, dropping out of treatment, and only seeking treatment when very unwell. These videos are people who use drugs talking about positive and negative experiences of healthcare.
Consider me as an individual whom you don't yet know, so at first meeting, a person whom you don't yet know, rather than a label and all the stereotypes that come with that.
Like there's a few times where I'm like, oh, nah, I'm a bit flustered, or I've got a doctor's appointment and that's nervous enough as it is. Oh, will they know that I've had a smoke this morning, or will they know this? And so then I would either cancel or, but in terms of, I found a GP that was just like, it's okay. It's okay. It's all right. Thank you for letting me know. And why are you here? Like, what is it I can do for you? And that's amazing.
She listened. Her feedback in the conversation didn't seem condescending. She didn't want to know why I used drugs in the first place. She asked about my general health. Just give me a rigorous going over, like heart check, lung check, blood pressure, all the things the doctor should be doing when they're looking after your health care. And it was just there was no condescending tone in her voice.
I have a really good example of this. So the new doctor I went to, I have been smoking a lot of weed recently and since the lockdown started, because we all had to cope somehow. And we kind of talked about my weed use over the years, and she just said, oh, well, let's work on getting you back to like recreational social use. Like, because that's kind of what I want. I don't particularly want to be smoking the amount of weed that I'm smoking now, but she was like, yeah, let's get you back to where you like get stoned a couple of times a week with friends. And that's so good, because that's not judging the drug or my use of it, it's just judging the context and actually it's not denying the pleasurable aspect of the substance, and it's seeing the risks while also accepting that it's something that I want to do, and it's kind of taking my perspective in as well.
I did have a positive experience when I was in labour and needed to have an emergency caesarean. The anaesthetist that I had as I went into pre-surgery, I was, as you need to be, I was very clear with him about being on methadone, and he was extremely understanding of that. He knew his position with that. He understood that I would require obviously higher doses of drugs to knock me out. He was accepting of the information I gave him. He was not judgmental. He took on board that information and made an informed choice and moved forward with it, rather than in other circumstances where you get that immediate brick wall. He understood what needed to be done and he went forward with that.
Being able to be honest.
It's an open conversation. He's very much able to hear where I'm at and what I want and need, and then also we're able to kind of work from there. So like, if I'm going bad sometimes, then like he's able to listen to that and work with that as well, which I find that kind of understanding helps as well. Like, it's an ability to listen to people and what they know about themselves and what they might need and want.
I'm in control of my treatment because I have the choice to go somewhere else. So I've learnt that over the years, I'm turning 40 this year, over the years, if you don't like a practitioner that you're with, I've learnt that you can go somewhere else, which I'm sure a lot of people don't have that sort of confidence that you can go and just, you make your own choices. mainly angry and then disappointed. Disappointed in society and the system.
The thought of having blood taken is just such an ordeal. And, you know, the doctor came to the bed and I said, don't use this one, don't use this one, try this one. No, I don't understand why, would not. And it was over an hour of trying various sites and even getting the scanning machine and here, none of it worked. Eventually, and got this doctor, this nurse, eventually tried this spot that I indicated because there was nowhere, got it the first time. And I was nearly in tears because of all the jabbing.
It's extremely frustrating and you feel so powerless. And when you're in a situation where you're not only dealing with the actual medical problem that they're ignoring, but you're dealing with the consequence of that, which is pain. And when you already have an opioid dependency, the only thing that's going to do is encourage more usage. And when you're trying so hard to get across to somebody that you just want the problem looked into, you don't even expect an immediate solution. You just want somebody to take it seriously.
Being judged. You get to my age, you can tell when someone's sort of not being open and honest and part of the conversation. You know, when they're just sort of ticking off boxes on the sheet and trying to get you out of there.
Doubt I would continue going to one if they were outwardly judgmental, or if like I just wouldn't go to a practice that said no benzos or something like that.
When you go in and you speak about yourself and you know what's happening, and they will tell you otherwise at a face value level, like because they feel like they've got a better understanding of what's happening, like it's a very big instant turn away. And yeah, I mean, I can name off experiences where that's happened before, just at general doctors. Asking for stuff as simple as antibiotics, it happens all the time.
For me, the most important thing is that we listen, and we listen well, both empathetically and without judgment, and that we do our best to hear who the person is, what their experiences have been, and what they hope to get through engagement with you and with health services. And then when we're looking into things further and we're talking, making sure that our language is appropriate and not using stigmatizing language, and that we demonstrate that we've heard what someone has said to us, and we hear where they're at and where they're hoping to get to, and hopefully helping them to that point.
First thing they could do was read NUAA's Guide to Language, because that's going to help a lot. Have open, honest conversations with the patient. Don't judge. Basically, those are the three.
You can build a relationship with your doctor. You can't clap with one hand. It has to be two hands. See? So if he respects you and you respect him, you can get somewhere. But if you start judging people, stigmatizing people, obviously that person is not going to respect you. And you're going to feel that he's been disrespectful to you. But who are you going to blame? Blame your own attitude and behavior. Be kind to people, people will be kind to you.
So I'd want them to ask a lot of questions, and not just medical questions, but also the human context in which I, as a medical subject, exist, because that's very relevant. I don't want to get a lecture. I don't want to hear the list of things of like why the things I'm doing are bad for me. I know this, like our society tells us all the time the ways in which they're bad. So a bit of curiosity and open-mindedness and empathy.
I think one of the most important things is really to actually sit there, make eye contact and listen. Don't continue on doing other things while the conversation is happening. And I think one of the really important things for doctors is don't assume that you know something about me, because I've got a drug history.
When I had a medical issue, I wanted that problem fixed. I didn't want her to then delve into things that I didn't think were medical issues because I can handle those myself. And I don't think there should be that just because you've given the information that you're a drug user, that then makes it a medical problem that you're there to be solved.
So for me personally, when I'm going to a doctor and I want help with something, say addiction counselling, it's a personal issue for me, but it's better if they don't treat it as a personal issue themselves. So when it's a mental health issue and they treat it as such, and they kind of look at your addiction from like a psychological perspective, or they look at it from how your body's behaving and reacting, then it's like, for me, it's a much less confronting consultation. Like I get a better understanding, and it's more judgment-free essentially. Like they're interested in the process and they want to help out, really. Like that's what I get from a good experience.
If there was one thing I could say to clinicians when they're working in this space, it'd be when a person mentions their substance use, be it illicit or illicit substance use, that is something that we are interested in a positive way. We'd like to speak with that person about that in a non-judgmental and a non-discriminatory way. We want to know about this person and their experience in that space as well as their general life experience, and be able to talk about it in an open and honest way about its impact on their healthcare. But we must also respect people's autonomy and their ability as adults in Australia to make decisions around alcohol and other drug use, and we should respect those decisions and work with people to ensure that they have as good health outcomes as possible, regardless of their choices around alcohol and drug use. Firstly, it should be individualised. So we're talking about people who use drugs, but that doesn't mean that every person who uses drugs is the same person, okay? So we need to explore who that person is, where they're at, what they're hoping to get from care, and what their choices or decisions might be around substance use at this point and into the future, and respecting those decisions and choices, and hopefully working with that person regardless of their choices. Their person-centred care should be holistic, so looking at every aspect of a person's well-being, their physical well-being, their psychological well-being, issues around their social well-being and their spiritual well-being, if that's something that's important to that person. And finally, I think person-centred care should involve rather shared decision-making. That is, that we as clinicians might have our opinions and beliefs around what may be best for a person's health, and a person's going to come to us with their own opinions and beliefs around that. And I think there's a lot of room and good room there to negotiate and educate and move to a point of shared decisions, and hopefully together deciding where we're going to go around healthcare decisions and working towards the same positive outcomes.
Level with a clinician if I feel I won't be judged, and if I don't get that judgment energy from them as I'm speaking to them. And I know that I've been heard if the subsequent behaviour of the clinician, be it in the prescriptions, the tests ordered, whatever, is consistent with what I've said.
In my case, when I started doing good, when I started doing what she said to me, and when she listened to my voice and my issues and turned around and gave me that advice, and when I started acting on that advice and I started getting better, that's when I knew that she was listening to me and I was listening to her.
I know that they've really heard me if the advice I'm getting is actually doable and applicable to me, because occasionally I just get a very generic health-based instruction that just doesn't work for where I'm at, where my life's at. So something that's very practical and relevant to me, that's kind of how I, like, if I have that thing of like, oh yeah, I can do that and that makes sense.
Based off of the responses I get, and then ultimately like the outcomes of the consultations and like where I go forward from that. Like if they're responsive, if they're organised about making appointments and seeing me.
For me, the main positive outcome would be that people come into a clinical consultation, which is often an intimidating environment for many people, and they feel comfortable and they feel free and open to be honest about who they are and about what they've done without fear of judgment or discrimination, and that we can work together towards optimal health outcomes. I think it's so vital that people don't feel that they need to hide certain parts of themselves or certain behaviours that they might undertake, because if people are doing that, the impact of that sort of internal stigma and stigma from outside as well are just so damaging.
You feel comfortable, you feel like you're able to go and approach these workers, talk to them about problems, and you feel like you're not going to be judged.
If I feel like empowered and heard, then I actually feel hopeful, and then I'm much more willing to do the actions that they're suggesting because they are doable.
I think it makes you feel empowered to actually make positive healthcare decisions. It makes you feel that you're being taken seriously, and it will give you the confidence to be able to take further steps towards things that you previously didn't maybe want to do because you were concerned of the outcome.
When you get a lot of judgment from outside people and then you speak to this person who's a health professional that understands you at a base level, it's like really relieving, because it does take a lot of judgment away from yourself, because there is a professional out there that sees you for more than what you're experiencing, essentially, and like sees you as just a person and will have an honest conversation with you and talk to you like a real person, and then to have a conversation about what you're going through with them, and it's just completely non-judgmental, like it does make you feel a lot better, and it is a massive self-esteem boost for sure.
I've had some lovely, blood collectors, but this doctor, I was so grateful, not just because it was painless and quick and efficient, but because this woman clearly lived in reality. You know, I'm a big one for the reality principle, and we may wish things to be different and should be this and could be that, but it often isn't. You know, what is the reality? The reality is the only vein that works for me is here. And she could see, obviously, I guess, that I was sensible and not. And she let me participate in my own, treatment. And she will forever stand in my mind as a rare case of a truly awesome doctor. It was wonderful. It was just wonderful.
This video focuses on person-centered care. Great health outcomes rely on great relationships with patients that are based on mutual trust and respect. Here we look at what that means through the eyes of people who use drugs. Understanding the perspective of people with lived and living experience of drug use who are seeking health care gives us an insight into the important act of listening. Listening is the foundation of creating meaningful relationships when people present with alcohol and other drug issues or with any health issue.